With tears welling in her eyes and a one-week-old baby cuddling in her arms, Janet Langat narrates her ordeal.
Nilikuja kujifungua.
It has been a week since the 22-year-old stepped into this private hospital in Kericho, overwhelmed by labor pain. But after a successful delivery,
Walisema ati hawakunileta hapa wenyewe, sasa mimi mwenyewe nijitoe hapa.
And with that disappeared her husband, leaving the jobless mother of 4 with a responsibility to foot a hospital bill totaling to 10,000 shillings.
Hospitali walinifunga wakaniambia mpaka nilipe bila.
Yes, the hospital has detained her, but only for a while. Still, it is a move that is likely to generate a heated debate. Ordinarily, one would term the action as insensitive, but as Dr. John Nyauma, the hospital's chief executive officer, explains, that is the predicament facing nearly all the private healthcare providers in the country.
When you receive a patient, you don't ask them whether they are able to pay. And even if they were unable to pay, you cannot return them because they are sick. So we treat them by faith.
According to a study conducted recently by the Kenya Association of Private Hospitals, only 40% of the bill incurred by a patient in a private hospital is paid on discharge, while 20% is remitted much later. The remaining 40% is never paid at all. And now Nyauma says the antidote is clear and precise: funding.
And we think that these challenges can really be met if the government was serious, particularly with the social health.
Research has shown that 90% of private healthcare providers do not have access to capital owing to stringent guidelines laid down by lending institutions.
The reason why banks do not want to give money to those people is twofold. One is that banks don't understand that business. And number two, those businesses also do not know how to present to the bank.
There are all sorts of clauses in contracts. Investment costs are very high, interest rates are very high.
It is against this backdrop that the Medical Credit Fund, working in conjunction with a local non-governmental organization based in Kisumu called KMET, launched a soft loan program targeting the private facilities.
We have disbursed 30 entry loans, a maximum of over 9 million, and 4 medium loans, almost hitting 10 million.
And Dr. Nyauma's hospital is one of the beneficiaries, with an initial loan of 400,000 shillings repaid at an interest rate of 12%. Nyauma's managed to renovate the hospital and purchase new equipment in a bid to enhance efficiency.
Through this approach, which is very innovative, the providers are now learning how to fish, and they are fishing in their own facilities by improving the quality.
But even as the new initiative begins to pay premium, concerns are raised on its capacity to accommodate small business clinics whose financial muscle is flaccid.
The businesses like Franciscan Aliakas and others are too small for some funding agencies.
If they did give us a longer period payment, a soft loan payment, it would be very